No? Can I start now? Okay. Good evening, everybody. First of all, I'd like to wish all the fathers a very happy Father's Day. And I would also like to wish all those hoping to be fathers soon the very best of luck. So this is a live chat, and we have received a few questions in the past 1 week. And I've decided to start answering those questions one by one. But if you have any questions to ask, please inbox it to us right away. So the first question is, I had a low sperm count, oligozoospermia. Which are the best tablets to use? I have been using Proviron and Manix. Can they help? So that's the first question. Well, the thing is a little bit about sperm counts. A low sperm count is when there are less than 15 million sperms per ml of ejaculate. And it is considered to be severely reduced if the sperm count is less than 5 million per ejaculate. Now, usually when somebody comes to us and they have low sperm counts, we tend to do some hormone tests. And then these hormone tests basically will tell us whether there's any deficit in the hormones. And we also sometimes need to karyotype and do a chromosomal examination for the male. The other commonly done test is a scrotal scan, where we can measure the size of the testis and also rule out the presence of a varicocele. So some of you may know what a varicocele is. It is basically dilated veins around the testis, which increases the local testicular temperature and can affect sperm production. So a very small number of men usually have a problem, have a detectable problem, which leads to a reduction in sperm count. So these men are best sometimes treated with hormones. Sometimes they're treated with, they may need varicocele surgery. Now, the vast majority of men usually have no problems at all. And they fall into the category of idiopathic or reason unknown oligozoospermia. Oligozoospermia is the medical term for reduced sperm counts. So for these men, we have to give empirical treatment, which is usually in the form of antioxidant therapy. Now, antioxidants basically contain a mixture of vitamins, minerals, and enzymes and amino acids, etc., which may improve the sperm count. Now, in your case, you've been using a tablet called Proviron. Proviron is mestrolone, which is the only testosterone which can be used in men with low sperm counts. Now, it may help if you have a moderate decrease in sperm numbers, but it may not be very useful in men with severely reduced sperm counts. And Manix is the other tablet which you're taking, which helps improve sexual performance. So a good idea would be to actually repeat the sperm counts after 3 months of therapy and see if it has improved. And if not, you could seek alternative help. Now, the next question we have here is, can we change sperm count and sperm motility through tablets? I don't want to do IUI or IVF, so please suggest. So I think it's perfectly understandable if you don't want IUI or IVF. Everybody likes to conceive on their own. But sometimes if sperm counts are very reduced, you may need help. So as I said earlier, if you've not undergone the extra investigations, it's worthwhile doing them, seeing whether there is a reason for the reduced sperm count, and seeing whether we can improve them by hormonal therapy or by antioxidant therapy. After 3 months of taking these medications, it's worthwhile testing again to see if there's any improvement. Right. So the next question is, when it comes to sperm count, what is a normal range? That's what somebody's asked. So Now, as far as normal sperm ranges are concerned, we look at three parameters. We look at the sperm count, we look at motility, and we look at morphology. Counts, as I said, should be at least 15 million sperm per mil of ejaculate. Now, the motility is movement, and there should be at least 40% progressive motility in a sample. And morphology is the appearance of sperm. And most of the sperm in any sperm sample will be abnormal. So it is sufficient if we have a normal range of 4%. That is by strict criteria, which is the best criteria by which sperms are to be assessed. So that's as far as normal range goes. Then what can I do to boost my fertility? Many men come and ask us this. And I think the answer is quite simple. Lifestyle modifications, maintaining the correct BMI, body mass index, and cutting down on alcohol, not smoking, quitting smoking, and exercise, and healthy food to eat. So this is the way one can try and boost fertility. So the next question is, I'm in bodybuilding and take protein supplements. Can this affect my fertility? So protein supplements will not affect fertility, so that's good news. But if you're taking nutritional supplements, you need to check to see whether there is testosterone in those supplements, because that may affect fertility adversely. And another word of warning for men with who are bodybuilding: testosterone injections. Testosterone injections are not a good idea at all, because testosterone injections increase the amount of testosterone in the body and decrease endogenous testosterone. So the body's testosterone production is reduced, and they can impair sperm production, sometimes irreversibly. So you need to rethink things if you're planning to start a family and you're actually using testosterone injections for bodybuilding. Now, the next question is, can you tell me what to do when a man cannot give birth to his wife? So it probably means, so I've not been able to get my wife pregnant, so what do I do? And there's a lot to be done. Basically, visit a specialist, and the wife needs investigations to see if her ovaries are okay, to see if her uterus is okay, to see if her tubes are normal and open. And the man, of course, needs a semen analysis. So these are the basic things which every fertility center would do to see what the matter is. Now, the next question is, can I learn more about a service? Probably the person has asked what the services are in our center. And it is easy. You just go to the website and look at the website, and there you have all the services which we offer listed and the description in detail. So another question is, how often does a man have to get tested post 30 years? Actually, age is not a factor, because men are luckier, and they usually tend to maintain normal sperm counts until beyond 50 years. So if you have a normal test, there is no need to repeatedly keep testing yourself. It's different with women, because women, the egg numbers do reduce as age progresses. Though men may have a deterioration in semen quality, usually the counts are not grossly altered as they age. The next question is, what is IVM, in vitro maturation? Now, in vitro maturation is to do with women. What we do normally is IVF, which is in vitro fertilization. So we give the lady injections from day 2 of her period. This is how we normally do an IVF cycle, usually for about 8 to 10 days, maybe a little longer. And finally, when the follicles Follicles are fluid-filled sacs which contain the eggs. When the follicles have reached a particular size, then we give the trigger injection. And that trigger injection helps the egg within the follicle undergo maturity. So maturation occurs inside the body. And then, about 36 hours later, we retrieve these eggs. We remove these eggs. And that's called, the procedure is called egg pickup, ovum pickup. Now, IVM is a little different. Here, usually the lady doesn't receive any stimulation injections, or there may be a slight stimulation called priming. And then these follicles, the eggs are removed when they're still immature. And these immature eggs are removed and made to mature in vitro in the lab. So that's why it's called in vitro maturation. Now, this was used, or this is used, for women with polycystic ovarian syndrome because it reduces the risk of ovarian hyperstimulation. But nowadays, with a different protocol, with the antagonist protocol, we rarely see any form of hyperstimulation. In my opinion, it would be more useful in women who have cancer and they don't have the time to undergo full stimulation. So IVM could be done, the eggs could be retrieved and matured and stored for later use when they recover from cancer chemotherapy. So that's about IVM. And another question is masturbating daily a problem for infertility? No, it isn't. It isn't a problem. Now, the next question is, I'm overweight, BMI over 40. Does this affect sperms in any way? Weight is a very important factor, both for men and women. And there is plenty of evidence to say that it affects fertility adversely. Now, fertility aside, a BMI of over 40 definitely needs attention. Now, as far as fertility is concerned, anyone with raised BMI, they tend to have hormonal problems, reduced libido, and the scrotal temperature also increases because of excess fat. And all this can affect spermatogenesis. Now, the next question is, I have been on medication for over 5 years for diabetes and hypertension. Does medication affect male infertility? Yes, both hypertension can affect spermatogenesis or sperm production, and so can medication given for hypertension. So if you're planning to conceive, it's worthwhile discussing with your doctor and getting the right choice of medication to control your blood pressure. The second thing is, as far as diabetes is concerned, yes, diabetes, definitely, poorly controlled diabetes can affect sperm production. So whenever we find a man is diabetic, we make sure that his diabetes is well under control before he actually starts undergoing treatment. Now, the next thing is, I have a low sex drive and difficulty ejaculating. How can I get my wife pregnant? Now, this is an issue which needs to be addressed by a urologist. We do give medications like Viagra, which is sildenafil, and its derivatives, and with promising results. And also, what you need is counseling, which can be done very effectively. So, the next question is regarding smoking and drinking, and will it affect my sperm? So, as far as smoking goes, yes, smoking in women smoking, men smoking, passive smoking, active smoking, all of it can affect fertility. Definitely, it does affect sperm production. So, our advice is we tell men and women to quit smoking because definitely it has very dire consequences as far as fertility is concerned. Now, as far as alcohol goes, as long as occasional alcohol, social alcohol drinking is okay. So that's with regards to smoking and drinking. Now, the next question is, my sperm is poor motility and not the correct shape. So what are the treatment options for my condition? what options do I have to get my wife pregnant? So, um, so there is two parameters are abnormal, uh, motility as well as morphology. Now, it is very difficult to correct morphology. Morphology is appearance, and we should have, as I said, at least 4 in 100 sperms should be normal to look at. And if sperm morphology is less than that, it's 3%, 2%, 1%, it becomes very difficult um, to conceive naturally, and you may need help. And if motility is also reduced, once again, antioxidant treatment may help after the initial investigations, which I've stated earlier. And if that doesn't work, then the treatment would be ICSI, where we can actually pick the most normal sperm and inject it into the egg. Then there's just one more question. So the question is, my sperm flow is blocked. What can be done to unblock it? What is causing this block? I have no problem with urination. Does this mean I'm infertile? So I think this is a very relevant question because he says there is blockage, and but he has no problem with urination. So yes, though it's the same passage, sometimes obstruction with the sperm coming out, with the semen being ejaculated, can occur higher up. Now, this is called azoospermia, when we don't find sperm at all and they ejaculate. And it has to be investigated very thoroughly once again. There are two types, and this is actually the better type, where there is obstructive azoospermia, where the sperm is being produced normally, but could be because of a congenital problem or an acquired problem. There is a block in the duct or in the tube, which leads the sperm outside. So it is very difficult to correct these abnormalities, but it is much easier to give a pregnancy by doing ICSI and TEASE. Now, TEASE is testicular sperm extraction, or testicular sperm aspiration is done, where we take the sperm from the testis and inject the sperm into the egg. So this is feasible. So yes, if somebody's sperm does not come out, it means you are infertile. It means, in this case, there is a blockage. There is another entity where production is a problem, but here blockage is the issue. It is much better than having a production problem because we can actually retrieve sperm directly from the testis. So that is with regard to the questions we have today. I have a comment from one of my patients who says, "Super, ma'am." So thank you very much. And with that, I think if anybody else has any questions, please inbox it to us. We will answer you later. And thank you so much for listening.